All right, doing pretty good so far. Let's get into some details now on HIV and AIDS, differences and similarities, and what they really mean. HIV is a virus that attacks the body's immune system. If a person with HIV does not receive treatment, they can develop AIDS. AIDS is, well, it doesn't say it just yet, but AIDS is what HIV becomes. It's like the designation for a certain amount of HIV in the system. It's not a separate disease. You can't have AIDS and not have HIV. So HIV is simply what AIDS becomes. Hopefully that's clear. HIV typically progresses through the following three stages. First, there is an acute HIV infection, meaning that it's detectable. Secondly, there's a chronic HIV infection, which means it's spread enough that you can basically, find it anywhere in the bloodstream now. And third is the acquired immunodeficiency syndrome, which means that it's reached such a saturation within the body that it is at a certain level that they've designated. Um, Obviously, the area where HIV starts to become fatal is when it hits the AIDS stage, but it's not actually the AIDS that kills you. Early symptoms include tiredness, fever, diarrhea, enlarged lymph nodes, loss of appetite, or night sweats. Again, you'll notice that a lot of these side effects, they conflate with other diseases as well. So it's not always easy to tell if you have HIV, even in the later stages. People with untreated HIV can also develop many other health problems like severe pneumonia, cancer, damage to the brain and nervous system, and extreme weight loss. Because as the immune system that's designed to keep these things out of the body or regulate the occurrence of them breaks down and is weakened, these things take an opportunistic approach and they tend to infect or affect the body more often. How it spreads is when infected blood, semen, vaginal fluids, or breast milk enters the body through mucous membranes, anus, vagina, penis, mouth, cuts, sores, abrasions on the skin, any sort of like opening in the body that the AIDS virus can get into, it can infect through. Now, if you have a detectable viral load, it means that you can transmit the virus. If you're infected, it means the virus is in your body and it will remain there for the rest of your life. You can be exposed to the virus and not become infected. But if you are infected, it means that's it, you're infected. Having unprotected vaginal, anal, or oral sex with someone who has HIV, that is basically the main way that AIDS is spread or HIV is spread. Using or being stuck with a needle or syringe that's been infected, typically that's another way that it's spread, but that's less common. Most of the time it's through sexual contact, unprotected sexual contact. And it does even say that, well, it doesn't say this, but even with condom use, that's still not 100% effective of keeping yourself from contracting the virus from a person who has it. So condoms aren't 100% safe. Nothing is 100% safe when it comes to sexual contact with someone who has HIV. Sharing of drug paraphernalia, this kind of has the same vein as sharing needles or getting stuck with the needle, except you're intentionally sticking yourself with the needle as opposed to unintentionally sticking yourself with it. But basically, that's the same thing. Okay? Giving birth. Women with detectable HIV infection can pass the virus to their babies during pregnancy or childbirth. And you may say, but wouldn't the baby already have it if it's part of the mother? Well, at a certain point during pregnancy, the baby and the mother stop sharing blood. And if the mother's infected with HIV after that point, then the baby won't have HIV by default. But it can occur during childbirth because there's a lot of exposure to blood and bodily fluids during that time, isn't there? Breastfeeding. Breast milk is made up of a number of different substances, but HIV can infect that breast milk and it can be passed on to the baby at that point. Or, of course, receiving blood through some form of transfusion or any kind of exposure. Obviously, that can happen as well. There's very careful testing of blood that's taken from donors for HIV, but you hear about it every now and then. Something slips through the cracks and somebody gets a bad dose of blood, or this was supposed to be disposed of and it got marked for transfer instead. So I'm not saying don't give blood, don't receive blood. I'm just saying that it's a way that it can happen, although again, extremely rare. So all those are ways it can happen, but the number one way is unprotected sexual activity. Okay? You can't get it through saliva, tears, or sweat, though. There's no blood in those inherently. Obviously, you can't get it from hand hugging, sharing toilets, closed mouth kissing, any sort of sexual activities that don't involve the exchange of body fluids or through the air. Okay? A lot of ways you can't get it. And it's really not that easy to get either. It does have to be transmitted in a large enough viral load that you become infected. Now, how it works in the body is once you're exposed to HIV, it enters your blood and attaches to white blood cells called T cells. The T cells are supposed to tell other cells to produce antibodies to fight off pathogens of all types, not just HIV, but all types of pathogens. This is a critical function of our immune system. But when the HIV virus attaches to the T cells, the antibodies produced to fight the HIV virus are unable to do so. And over time, they destroy these T cells and the body's immune system. So it leaves the people vulnerable to infections that normally someone with a healthy immune system wouldn't ever have to worry about. Or maybe they wouldn't have to worry about it until much, much, much later in life. Things like I said, cancer and other life-threatening diseases, or even a simple infection. Like, oh, I cut myself and it got a little infected. That can grow into a huge problem, maybe even loss of your limb. It's like it can get bad. There's a little picture there that shows how the HIV enters the cell. So when does it become, and how does it become AIDS? Well, AIDS, all people diagnosed with AIDS have HIV, but not everyone who has HIV has AIDS yet. It begins when someone has an HIV infection and their T cell count is below 200. Okay? That's when the T cells have reached a level where they can't hardly do really much of any job anymore. And they're just doing the bare minimum to keep you alive at this point. Or they have an opportunistic infection and cancer that can occur in the presence of HIV infection. Once they have AIDS, the diagnosis doesn't change back to HIV if the T cell count goes back up. When you have AIDS, you have AIDS. There's medicines, there's things that can help you if you have AIDS and improve your quality of life and improve your immune system. And there's lots of things you can do with your diet and your exercise, just like there are if you don't have AIDS. So obviously, if you do ever contract HIV or AIDS, you'll want to live the healthiest, cleanest lifestyle you can, exposing yourself as little as possible to germs and bacteria and contagions, and making sure your immune system is as healthy as possible. This is going to prolong your life and make a much longer span of time before that HIV can become AIDS, or that AIDS will allow opportunistic infections to take your life. Medical treatment can delay the onset of AIDS. Without treatment, a person usually has about 10 years between I have HIV to I have AIDS. But that window can drastically change based on what your health actually is at the time you contract it and what you do after you contract it. Averages are averages. That's just what they are. They're middle ground. Some people are 2 years, some people are 20 years. To stay healthy as long as possible, make sure you learn your HIV status as soon as you can. If you think you've been exposed or you think you've been infected, get tested. Don't worry, don't wait, don't wonder. Find out. It's important that you know. Proper treatment does the same. Proper treatment provides almost the same life expectancy as someone who does not have HIV. Okay, as you know, many people have contracted HIV over the years. Famous people, maybe people you know, but you've probably been exposed at some point in your life to someone who has had HIV, and you'll probably know that some of them are still alive today and they're living, normal, healthy lives because they're getting proper treatment and they're taking care of themselves. So it's not like back in like the 70s and 80s when it was basically like, we don't know anything about this disease. It's probably a death sentence. Now it's been worked out a little bit better where it's not the end of all means. Okay? It's still terrible to happen, but it's not the end of everything. Now, over to page 129, looking at some diseases associated with HIV and AIDS. These are called opportunistic infections, and there's some of them here, but obviously not all of them are listed. Pneumocystis carinii pneumonia, which is a very severe form of pneumonia. There you've got Kaposi sarcoma. It's like a skin cancer, which is very terrible. There's a whole bunch here. I could sit here and read through all of them, but you don't need to know what they are. You just need to know that they exist and realize that there are a lot of diseases associated with HIV and AIDS. Let me take a quick break. I'm going to take a sip of my water, and then we'll be back and talk about how to prevent HIV. All right, we're back, and we're ready to start talking about how to prevent HIV. There are many tools available to prevent HIV. Talking to your clients about strategies you can use or methods you can take to prevent the infection are always a good idea. You can, counsel, advise as best as you can. Some of these are highly personal things to talk about, though. So it's tough to say this is appropriate to discuss with your client. But at the same time, it's sort of essential that you bring up these things if you see they're exhibiting the types of behaviors that might lead them to a risky contracture of HIV. For example, if they're prone to sexual activity and you know that they're not being careful or cautious, or they have multiple partners, or if you know these things are going on, then you could counsel them and just let them know the facts and just say, hey, I care about you. I'm not here to step on your rights to do whatever it is you want to do, but I did want to make sure that you're being careful, Or if they're using, using condoms, make sure they're using condoms because, again, it's not 100% effective, but it is highly effective against preventing HIV. So that's certainly better than nothing. There's also medicines called PrEPs, which are pre-exposure prophylaxis, and they're a medicine that people who are at risk for HIV to take. If you're at risk for HIV, your doctor kind of has to designate you as such, and so this is a prescription medication. You can't just take it because you're like, I'm normal and whatever, I'm just going to take it for fun, over the counter. It's like Tylenol. Nah, you got to get a doctor to approve this one. You can decide not to have sex. You can get treated and tested for STDs. Again, people who have STDs are likely to get other STDs because anybody that involves themselves in behavior that got them the STD in the first place means that they weren't careful in the first place in most cases. Sometimes accidents happen. It can happen even with your partner who you're both faithful to, and one of you just got something and the other one spread it. It can happen. But most of the time, it's with people that you don't know or people that you don't know their sexual history from. And that's where the STD spread the most commonly. So if you know they're getting STDs, then you definitely want to be like, hey, you're kind of at risk here. Maybe you want to be more careful. Again, it's a really touchy subject, and it's going to be hard. And I'm not saying you have to breach the subject with people. If you're not comfortable talking about sexuality with people in a professional, I'm here for you, I care about you way, but not in a weird, I'm getting way too up in your business way, then I would say stay off the topic or consult with another member of the care team who might be better at conversing with them. You know what I mean? Because you can just come across as weird or creepy if you do it, whereas you're trying to just be helpful. So sometimes it's like, you know what, we're going to pass the ball to this person because they're a little better suited for this conversation. Use good judgment and think about it before you do it. Now, what about some treatments for HIV? Well, there is no cure at this time widely available publicly for HIV. It is treatable. In fact, most people take a simple once-a-day medication. There's all kinds of treatments and things that you can do that won't eliminate it, but it'll at least reduce it to the point where it's undetectable, meaning that the chances of you spreading it are virtually nothing. Okay? And also, it probably won't go to AIDS if it's undetectable, will it? Because it's not overwhelming your immune system. So that's one good thing. At least we've advanced that far, because those weren't around a couple decades ago. Let's see here. What else? Go over to page 130 with me. We'll talk about undetectable. The U equals U concept means people who are living with HIV who are undetectable are also untransmittable. Kind of what I just said about you can't spread it if you can't detect it. I trust that somewhat. I personally, my feelings, I would not have sexual relations with a person who had HIV, whether it was detectable or not. I'm just that way. I'm careful myself. Yes, it might be undetectable, but I still would be like, I don't know. I don't feel right. I don't feel comfortable. That's just how I feel. You're going to feel how you feel about that as well. You can't discriminate against somebody because of it. You can't stigmatize them or make them feel bad about it. But your exposure to that person is entirely dependent upon you. And the limit to which you're willing to expose yourself to that person is something that's your right to choose. Okay? So remember that. How about testing for HIV? If you're a person who's been exposed to blood or body fluids of another person, you might need to get an HIV test. And if there's a facility or a company you work for that has a specific way of doing it, sorry about that, had a little hiccup. What I mean is, if there's a process in your facility or organization and you're not sure how to do it, make sure you check in and find out how the testing is done. And if you don't have a facility or organization that's there and your employer is your client, then talk to your doctor, and your doctor will explain how best to do these. Now, there's no HIV test that can detect HIV immediately. There's something called a window. And the window for most people is anywhere between 10 days to 3 months. So there's a time frame where like you'll be detectable, but maybe. Immediately after getting exposed, though, you're not going to be able to know if you've been exposed. But what you do is you go get tested anyways to establish a baseline. Remember the baseline? Well, this is your baseline. And the baseline is established there to find out what your T cell count is, and they look at some other factors in your blood as well. And then after a while, they're going to test you again, and they're going to look for presence or evidence of the virus in your bloodstream. They may not see it, but if they see factors in your blood that show that there's an indication that HIV might be present, like a lower T cell count or some other factors of things that they're looking for, then they may say, you know what, you should come back in another month and we're going to test you again. And they'll continue to do that as long as you're showing symptoms or exhibiting a presence that could indicate HIV is in the system, even if it's not detectable. It's real important that you know if that's there or not, isn't it? Now, being tested. You do have to give consent to be tested, obviously. And, there's many different ways or places that you can be tested. At home, in a facility, in a hospital, lots of ways you can get it done. And if you're not sure, like I said, talk to your supervisor, talk to your agency or organization, and they'll direct you to where normally their employees get tested in the event of an accident or something like that. Now, testing can be confidential. It can be anonymous, okay? And it means that you want your results kept private. The person doing the testing will know the results, of course, but they're not going to share those results with anyone other than you. They're not going to give the results to your mom or your wife or your kids or your employer or anybody else like that. And nobody who's not you is going to be able to access those records by calling and asking. And that's how it should be. Confidentiality with a disease like this should be a factor that's built in there. However, as we discussed before, there's a line between keeping something confidential and hiding something. Now, it becomes hiding it when you have a communicable HIV-related disease and you are continuing to exhibit and act in behaviors that involve the sharing of blood and body fluids with other people, and not telling them that you have this highly contagious, communicable, and oftentimes lethal disease. Okay? That's when it becomes a problem. Now, I'm not saying you have to tell people your condition. You don't. But it is sort of an obligation that if you're going to be doing things where you're going to be exposing people regularly to your blood and body fluids, you should share that with them so they can make an informed decision about whether or not they want to continue doing that and putting themselves at risk. It's the right thing to do, and it's the human thing to do. Okay? Without getting too graphic, I hope you understand what I mean there. And the same holds true for your client. This is where the whole, basically having them legally being forced to get tested if you think you've been exposed thing comes into play. Because some people will hide their diagnosis from people. And even if they know you've been exposed, they still won't want to tell that they have HIV because they're going to be afraid of retaliation from you or from society or the stigma attached to it or other reasons. So yeah, confidential is good, but there's also obligations and responsibilities that come with a disease like this. Now, over to page 131, okay, some counseling. There is preventative counseling for people who are at increased risk for HIV infection, people that want information or want to talk to someone about it or about their fears or worries or maybe ways they can prevent it. And then there's also counseling available for post-test situations where people maybe got the test results and now they want to talk to someone as well. Okay? If you're not sure if you qualify for either, check with your medical care professional and normally they'll let you know. Okay? Also, your employer may have options for you as well. Pre-test counseling, you shouldn't need it if you're paying attention to this book because you're going to know pretty much what you need to know, but there still may be more questions you have. So ask if you need it. But don't be afraid to seek post-test counseling if you feel like you've been exposed. Okay? All right, going to take a quick break. We're going to be back and talk about reporting. Hey, okay. So some reporting requirements. A healthcare provider must report HIV and AIDS cases to local health jurisdictions within 3 working days of diagnoses. Now, that's you, isn't it? Yeah, that's you. You're a healthcare provider, and it says you have to report those. But what if you want to keep anonymous? What if you don't want to report? Well, positive results obtained through anonymous testing are not reportable. But when HIV positive patients are seen for healthcare tests are obtained, the healthcare provider and their labs must report the case. So federal law also requires that states take action to require a good faith effort to be made to notify all spouses of HIV-infected persons. This dials back to what I said before. So there can be legal consequences if you have HIV or AIDS, are doing activities or working in an industry where exposure to other people is highly likely, and then they're exposed and it's found out that you never told anybody. So yeah, that can come back on you real bad. And the last thing you ever want is to spread this to someone else that you care about, just because you're afraid of what they might think. So think about that and be mindful of those things. It's a very serious disease. There are laws against discrimination, of course. Essentially, it's illegal to discriminate against someone who has or is believed to have AIDS or is HIV positive. You're not allowed to discriminate. You can't say, I won't hire you. You can't say, I'm not going to rent or sell this to you. I'm not going to let you come into this restaurant or theater. I'm not going to provide legal or health care for you. I'm not going to provide personal services. I'm not going to bake you a cake. I'm not going to give you health insurance. Things like that. Now, there are some insurance transactions that it is legal to discriminate against, like life insurance, for instance. It's very, very hard to get life insurance if you have HIV. You can probably imagine why. But other types of insurance, they can't discriminate against, like car insurance or health insurance or things like that. So discrimination for any reason is typically a bad thing to do. It's a wrong thing to do, right? Now, do you think people still discriminate against people who have HIV or AIDS? Yes, they do. Discrimination is extremely common against people who have this disease because there's a long-standing stigma against it. And shunning people who have it and, oh, they have AIDS, stay away from them, like breathing the same air that they're breathing can spread it. So there's a long-held ignorant beliefs about this disease that cause a lot of people to place stigma upon it. This is why these laws had to be put into place to protect people, because it got that bad. Things are better now, obviously, but they're still not perfect, which is why these laws continue to remain in existence. When you live with HIV, there's a lot of things that you can experience and go through. Most of the people, or half of the people, as of the time this book was being put together, half the people were over 50 years old who had HIV. And the amount of people who have HIV is obviously going to grow significantly and has grown since then, because it's a communicable, spreadable disease and the population keeps growing, doesn't it? But understanding what people go through when they have HIV or AIDS is an important part of working with someone who does. They lose their physical strength and their abilities little by little by little. Maybe they lose their mental abilities. They're running out of money because of all the treatment and things that they have to do. Their health insurance might be charging them extra, raising their rates, increasing their premiums, or dropping them altogether. They could lose their house, their personal possession. They might not be able to take care of pets anymore, and their pets have to be given away or sold or sent to a pound or something. I mean, there's so many things that can go wrong in someone's life when their health slowly but surely begins to degenerate and decline. Because not everyone can afford the kind of treatment that it takes to hold this disease at bay. A lot of people just have to live with it and then eventually die from it. It's a shame, but it's how it is. And so working with someone who's a very low income individual who doesn't have a lot of resources at their disposal, they're going to go through pretty much all of these things during the course of the disease. Turn with me to page 132 now. I'm going to talk about some support. First of all, there's psychosocial support, which is one of the most important ways you can support somebody. There's not much you can do for them physically, is there? You can help them, you can guide them, you can assist them with things. But I mean, like as far as like day-to-day life, you can't make their muscles stronger, can you? So mentally supporting them is one of the best ways you can help them. You know, being there, talking to them, guiding them, helping them with advice, or just a shoulder to cry on or a person to talk to sometimes can be helpful. People who have HIV or AIDS, they have a lot of pain, physical but emotional as well, because of the losses they've experienced. The ones on the last page we just talked about. They go through the loss of the life that they knew in many cases. They go through a period of disbelief where they just are like, this can't be true. I don't have it. Or I can beat this. I can fight this. I can cure myself. And they get desperate. They start trying all kinds of different wacky things that they think they can cure this disease with. They read about it on the internet and they go buy this stuff and they spend money they don't have. And, oh, I'm going to go see this doctor. He says he can cure me. I'm going to fly to this country and they have a special cure in this country. I've seen all kinds of people fighting this in all kinds of ways that were not productive. They can be afraid, very afraid of the unknown. You know, if it's this bad now, how bad will it be a year from now? Will I even live another year? And being rejected by family, friends, or coworkers, people that they once considered friends and relatives and close acquaintances, now don't want to have anything to do with them because of that AIDS stigma. Feeling guilty about the disease, or feeling guilty that they maybe transmitted it to other people. You know, you can live a long time with HIV without knowing you have it in many cases. And so if you're somebody who's sexually promiscuous, you could have passed this along to many, many partners before you knew it happened. And that can leave you with a feeling of guilt because you weren't never trying to hurt anybody. You had no intention of passing this along to anybody. You had no idea you had it. And so is it your fault? I mean, you did it, yes. And so you're going to feel that guilt inside, even though it really isn't your fault, you know, but people are going to feel that. You know, just the overwhelming sadness, general hopelessness, of course, and feeling angry. The anger at the disease, the anger at the life, the anger at the raw deal they got. This isn't fair. You know what I mean? The anger that comes with it. Oftentimes, the caregiver could have similar feelings to the person living with HIV because they're going to feel what the person feels. They're going to feel empathic towards them. They're going to feel the emotions and anger, the frustration that they have because they care about this person. And it is very easy to you know, feel the feelings of the person who's going through this. There's many organizations that give support. You can go to this doh.wa.gov, Illness and Disease, HIV Client Service. You can go there. They have a list of providers that are there to help provide services and provide support to people who have the disease or for people that work with people who have the disease. So it's a good resource to take a look at if it's something personal to you that you need a little helping hand with. There's also, of course, risk after exposure, which is in the resource directory we'll talk about later. And the final thing I'm going to talk about is just the stigma. You know, we have to be realistic, and people will discriminate against people with AIDS. There is a stigma attached to it, and it's very hard to break that stereotype. It's like stereotypes about people of race or religion or gender or sexual orientation or anything else. Anything that's a stereotype is something that a lot of people widely believe to hold true about a certain group of people. And so as a result of that, discrimination can occur because people think negative things about people and they just assume those are true and they treat them as such. You know, I assume because you have AIDS, I can catch it from you, therefore I'm going to stay away from you. That leads to a lot of social isolation, doesn't it? It's not nice. Try to make sure that if your client does have HIV or AIDS, you make sure you keep it confidential and you never spread that around. The only time you ever would mention it is if there was an exposure to another person in which the contraction of HIV from your client could highly likely occur. At that point, yep, then it kind of falls upon you to let someone know that, hey, you should probably get tested. I can't say for sure if my client has anything or not, but it'd be a good idea to get tested. That's a simple way of just kind of saying, yeah, go get tested without outing your person or your client. So, in summary, HIV, AIDS, hepatitis B and C, and all those other bloodborne pathogens, they're dangerous, they're nasty, they're mean, but they're preventable, easily preventable if you take the common precautions and you use your standard protective equipment. Make sure if you're exposed, you get tested, you take immediate action, and you minimize the risk of the contraction of the disease by cleaning and sanitizing and disinfecting whatever it is that got exposed. Okay, so let's go ahead and go through the checkpoint now. All right, answer the questions as always. Be prepared to talk about them in class. And at the end here, do your little module review, answer your questions, and we'll go over them in class. That ends Module 6, and I will see you again back here for Module 7.